So healthcare-associated infections sometimes are known as HAIs, are the types of infections a patient will acquire usually within a hospital setting. That could be from the entry point in an ER all the way through routine surgery or even in post-care. So for instance, places like a dialysis center for ongoing patients or perhaps even a nursing home or a long-term care facility. So it's really a definition based across all healthcare spectrums. Unfortunately, a very big problem. It's really a subset of a greater problem surrounding antimicrobial resistance or antibiotic resistance. But when you specifically look at HAIs, depending on the literature you look at, the research, the numbers range from around 750,000 patients all the way up to about 2 million. So it's a big range. Certainly there's a major issue around HAIs. Even the definition has something to do with that kind of range of numbers because some people define it a little differently than others. Current statistics state that about 1 in 25 patients that enter an acute care hospital will acquire an HAI. So this is a really sad thing. You know, they go in for a procedure or surgery or something else to help them with their health, and many times they obtain one of these types of infections. Some other numbers that might be of interest to others is that just the simple cost. So again, there's a range, but in the US dollars, most literature states that between about 28 to 45 billion dollars is attributed to HAIs. Going all the way back to the 1940s, maybe a little before that, when antibiotics really became part of our society. Miracle drugs, for sure, you know, saving lots of life. It's actually helped the U.S. win World War II. But what happened is even at that point, Fleming, who discovered penicillin, even let us know he actually had a press announcement about he was already seeing and witnessing resistance to his miracle drug penicillin. But the horse was out of the barn. It was a miracle drug. I mean, truly it was saving lives. As you can imagine, it was brand new. The microbes hadn't really adapted or evolved to that. But over time, so over the last 40, 50 years, we've seen a bigger and bigger problem occurring. Currently, the World Health Organization actually estimates that there's about 1 new infection every 3 seconds globally. So again, this is kind of scary when you think about what's coming when you enter a healthcare facility and really the community. And I'll maybe talk about that momentarily, but the other kind of things they mention, again, this is based on predictive modeling, but they say that probably by 2050, which is hopefully in our lifetime, by 2050, we're looking at anywhere from $100 trillion impact economically when we talk about healthcare and trying to deal with these types of infections, and probably, unfortunately, 10 million deaths annually. So this is going to supersede cancer. This will be the global public health issue. And one of my concerns, and one of the reasons I love doing these types of informational sessions with the lay public and others, even in healthcare, is that I think it's the #1 problem. There's a lot of problems, we all know that, but antimicrobial resistance is going to be a significant issue for anyone, from a scraped knee, think of delivering children, just things we take for granted, right? We're going to be perhaps going back to pre-antibiotic eras over time, where when someone enters a healthcare facility, there will be significant worry and concern over, will I, acquire an infection that I can't just take a pill or get a shot for? So that's a huge concern.